Hello, and let's get started. Now that you know the basics of when a member has Medi-Cal as primary insurance, let's find out what it's like when a member has other health coverage. What does it mean when a member has other health coverage? A member who has been granted Medi-Cal benefits and still has other health coverage. People covered under SenCal Health's Santa Barbara Health Initiative or San Luis Obispo Health Initiative may also have other private group health insurance. Having private group health insurance does not affect a member's eligibility in any way. Example of members who have OHC: HMOs, Kaiser, Medicare, PPOs. Those are some examples of members who have other health coverage and we come in as a secondary. But one may ask, why is it important to identify the other health coverage? Here's an example. Say a member or a provider calls and has a question involving the member's benefits. You want to make sure that the member has or doesn't have other health coverage because the member's coverage will depend on how we manage that particular member's benefits. I have some points to make. SenCal Health will always be the insurance of last resort. Member does not require a referral to see another provider or specialist if provider accepts primary insurance and willing to bill us as a secondary. Authorization is not required if primary covers the visit or the procedure. And lastly, the provider must accept the member's primary insurance. So here's the question. A member calls requesting if they need a referral to see a specialist. Member has Blue Cross as primary and SenCal Health as secondary. Does the member require a referral? The answer is no, the member does not require a referral. Member has a prescription and the primary insurance pays for the medication with a copayment. This medication usually requires a prior authorization through SenCal Health. Does SenCal Health require an authorization? No authorization is required since primary insurance paid for their portion. What if a provider bills us before billing primary insurance? Claims will be rejected. Let's discuss a little bit about how payments work when SenCal Health is the secondary insurance. A provider bills services for $25. The member's other health coverage pays $15. The outstanding amount is $10. Now Medi-Cal allowable amount for that service is $14.75. So the amount that SenCal Health pays is $0. The reason for that is that the other health coverage has exceeded the Medi-Cal Santa Barbara allowable, so no payment will be issued and the member cannot be billed. Here's another example. Now, a provider bills services for $100. The member's other health coverage pays $50. Medi-Cal or Santa Barbara Health Initiative allowable is $75. So the amount that SenCal Health or Santa Barbara Health Initiative will pay, $25. Because the other health coverage has paid less than Medi-Cal Santa Barbara Health Initiative allows, that's when an additional payment will be issued to the provider. This is what the other health coverage codes chart looks like. This shows all the different codes that will come up in the OHC box. There are currently no Kaiser facilities in Santa Barbara County, yet Santa Barbara Health Initiative members may still be coded with a K. No services will be denied due to Kaiser coverage through SenCal Health, Medi-Cal, Santa Barbara Health Initiative, other than emergency services. Providers should not deny members who are coded with a K for medical services. Any claims that are denied to Bill Kaiser will be reviewed to verify that the services were not emergency services or were not provided in Santa Barbara County. If it is found that the service provided was indeed an emergency or the provider was an out-of-area provider that does not accept Kaiser, the claim will remain denied to Bill Kaiser. This is an example of a member who has Kaiser insurance. There are currently no Kaiser insurances in Santa Barbara or San Luis Obispo County. Therefore, providers directly bill us for services except, again, for emergency services. Scenario time. Here's an example of a member showing he has Kaiser insurance. MSR. Call members PCP and provide them with member information. Explain to them that they can bill us directly for services. Once they have confirmed they will see patient, let the member know. Let's move on to Pay and Chase. Code A, Pay and Chase. In contrast, the Pay and Chase method occurs when SenCal Health pay providers for submitted claims, then attempt to recover payments from liable third parties. This is an example of a member with a Pay and Chase code. Scenario time. Looks like the member has a code A. Let's move forward with dental only coverage. Code L. If a member is coded with an L, dental coverage only, claims should be sent directly to Santa Barbara Health Initiative, SenCal, for reimbursement. The L code will be overridden and the claim will be sent through for processing. This is an example of a member who has dental only benefits. Primary care providers would still bill SenCal Health for benefits SenCal Health manages. This is an example of a member who has dental-only benefits. Primary care providers would still bill Sencal Health for benefits Sencal Health manages. This is an example of a member who has OHC Anthem Blue Cross. Circled here, code V, Anthem Blue Cross. As we look further, you can see that the member has Anthem Blue Cross and still active as it indicates 9999. Sencal Health is secondary to members' Anthem Blue Cross. Active OHC insurance always ends with a 9999. Scenario time. Example of a member with OHC code P. This indicates that the member may have a PHP or an HMO. Medi-Cal is month to month, so pay attention to the dates of service. Notice member in the month of January does not have other health coverage, but pay attention to what date we are checking. Other dates, the member does have other health coverage, code P. I pointed out 2 dates of service, so focus. Other dates of service, as you can see, it says code P. Member does have other health coverage in those months. Now here's an example of a member showing he has Blue Shield of California. And here I've circled where it shows that the member has OHC. Notice here it shows here that the member has Blue Shield of California and that it's active. So as far as we know, when we look up the member's eligibility, the member does show that in November he has primary insurance Blue Shield. But then we get a phone call from the member. Let's see what he has to say. It's time for another scenario. Here's what you do. As you can see, member is showing he has other health coverage. Contact recoveries to check if other health coverage is terminated. Email a screenshot, or you could call them as well. but on the safe side, always send a screenshot. Once Recoveries does let you know if the OHC is terminated, here's what you do. Let member know you will call them back. Also, call the doctor to advise that it has been terminated if that's the case. Now that Recoveries has verified member doesn't have OHC, notice the member's OHC has changed to no. It enters a note after checking OHC. As you can see, it now says that it has terminated. MSR, email or call Recoveries. Once they have checked if that OHC has terminated, they will let you know. It emails you back and you find that Blue Shield is terminated. You can now take action. Call the member and provider to advise. Look, Recoveries has entered a note. Now that Recoveries has verified member doesn't have OHC, notice the member's OHC has Now that Recoveries has verified member doesn't have OHC, notice the member's OHC has changed to no, or N. Great job, student! You're on your way on becoming an expert in OHC. Let's talk a little bit about members with Medicare. Dual eligible Medicare-Medicaid coordination, known as dual members, coordinates care for individuals who are eligible with both Medicaid, with us it's Medi-Cal, and Medicare, dual eligibles, or Medicare-Medicaid enrollees. So who is Medicare eligible? Here's some eligibility basics. A couple ways of getting Medicare. 65 years old and eligible for Social Security benefits. That's one way of getting Medicare. Also, some members are 65 years and younger, however, are receiving Social Security benefits due to a disability. That's another way that one may be granted Medicare before the age of 65. Members who have Medi-Cal are welfare recipients and other low-income persons. So dual eligibles are individuals meeting requirements for both plans. Medicare Part A, the hospital insurance program that covers inpatient hospital, skilled nursing facility, hospice, and home health care. Medicare Part B, this is an optional supplementary insurance that covers physician and outpatient hospital care, laboratory tests, medical supplies. About 95% of Part A recipients voluntarily enroll in Part B. This one isn't as common. Part C. These are managed care plans referred to as Medicare Advantage that provide both Part A and Part B benefits. Some plans provide some restricted prescription drug benefit. Lastly, Part D. The new outpatient prescription drug benefit that was implemented back in 2006 and is still current. Senka Health does not come in as a secondary with Medicare Part D. SenCal Health may cover some medications not covered through Medicare. When you learn about prescription pharmacy, your trainer will show you medications that are covered for members with Medicare Part D, indicated with an asterisk. This is very important to know. Opting out from Medicare Part D. This is when an eligible beneficiary chooses not to join a coordinated health plan and keep his or her Medicare benefits separate by choosing a Medi-Cal plan only. You see, if a member decides to opt out of Medicare Part D, SenCal Health will not cover members' medication. This is not advised for members to do this, and important to let the member know that if they opt out, medications will be their responsibility. For knowledge, this is what the member's Medicare card looks like. This is the Medicare Part A and Part B. These are the OHC code indicator for members with Medicare benefits. A, B, and D, A, B, and D, and an HMO. Medicare A and B, Medicare A and D, Medicare B and D. Here's an example of a member with Medicare Primary. This is the most common way you will see a dual member who has Part A, B, and D as primary insurance. Here's another Medicare example. This member is coded with F317. That means that this member's primary insurance is Medicare A, B, D as in David, and has an HMO. Remember, SenCal Health is always insurance of last resort. Here's an example of a member whose Medicare benefits have changed. A member's OHC can change each month. Here's another example. This OHC Medicare member has a 022. Member has Medicare B and D. Member has Medicare Part A, B, and D. Forward, what does a member present when they have other health coverage to a provider? This member who has Anthem Blue Cross presents their Anthem Blue Cross card, the benefits identification card, as well as the SenCal Health card. All three of these cards have to be presented to a provider at all times. No questions. Here's an example if a member has Medicare as primary. That's right, their Medicare card, their benefits identification card, as well as the SenCal Health card. This is what the member who has Medicare always presents to providers, pharmacies, any type of medical provider. Which program pays for what service? Medicare pays for hospital care, skilled nursing facilities, home health care, prescription drugs, durable medical equipment. Medi-Cal pays for Medicare cost sharing, nursing home once Medicare benefits exhausted, optional services, dental, vision, prescription drugs not covered by Medicare. Your trainer in pharmacy will let you know which ones those are. Durable medical equipment not covered by Medicare. Those are things that are covered by Medi-Cal. Test strips are a Medicare benefit. SenCal Health will cover as a secondary insurance if the test strips are covered through Medicare Part B. However, sometimes test strips are processed through their Part D, as in David, and in those cases, we will not cover as a secondary. Medicare Part B, medical insurance, covers some diabetes supplies, including blood sugar, glucose test strips, blood sugar testing monitors. What this means is if diabetic supplies is covered through Part B, as in boy, we will cover as a secondary. However, if member is getting supplies through Medicare Part D, as in David, we will not cover as a secondary. This concludes Introduction to Other Health Coverage. By now, you should be able to identify the difference between a member who has Medi-Cal as primary and a member who has other health coverage, whether it be an HMO, Kaiser, or a dual member. Remember to always use the tools and resources you have, and never be afraid to ask questions. Until next time.